Assalamu alaikum wa rahmatullahi wa barakatuh. For this session, we will start with the occupational health nursing from the community health nursing sessions. So the objective for today's session, we will define occupational health nursing and the relationship with environmental health nursing, describe also the different type of workplace and hazard and its causes, specify the role of occupational health nursing, identify the standard of occupational and environmental health nursing practice, identify the objective and strategies of occupational health program in Oman, and also state the component of the program of injury prevention and safety promotion in Oman. So, in introduction, as an adult, we are spending around 1/3 or 1/4 of our life at the work, and which become an integral part of our part. All type of worker, also all type of work, it has hazard, depending upon the work that you are doing. Either the hazard, it might be a short-term or a long-term hazard. Also, hence it is necessary to provide occupational health and safety services to prevent and manage occupational health and illness and injury. It is important because of those causes. So, in definition of occupational health nursing and the relation to health, to community health nursing, occupational health and environmental health nursing is a specialty practice that focus in the promotion and prevention and restoration of health within the context of safe and healthy environment. So we have to maintain a healthy environment in order to maintain those things. It is include the prevention of adverse health effects from the occupational and environmental hazard. So we have to prevent the adverse effect of the environment and the occupational hazard which might be there. Also, one of the definitions that it provide for the delivery of occupational and environmental health and safety services to workers, worker population, their family, and community groups. So the occupational health nursing, they are providing, and the environmental health nurses, they are providing health and safety services to the worker, to their family, and to the community group. Occupational and environmental health nursing is an also autonomous specialty, and nurse make independent nursing judgment in providing of healthcare services. This is by American Association of Occupational Health Nursing. This is the definition of American Association of Occupational Health Nursing. Here, the importance of this definition, or this part, that the community health nurse and the environment or the occupational health nurse, she is the main direct one who will be in contact with the worker. So she has to judge, and because of that, she has to judge in their health assessment and in what to do. Because of that, she has to have a good experience in healthcare. Additional information also, in certain developing countries, around 23% of the miners and workers in quarries suffer from pneumococcus sources, So it is an inflammation of the lungs due to the inhalation of the dust from the miners, from what they are digging and they are working with. And prevalence of biocinosis also and other respiratory conditions have been reported in those countries. So they are more exposed to respiratory disease. In some Asian countries also 5 to 7% workers have tuberculosis of the lung. In Oman there is a rapid increase in the growth of the industry within a short duration, hence work relation to hazard could pose a major problem in the future because of the large population of workers. The general problems, nursing home workers, so about the occupational health, the nursing home worker, 40% with they are having back injury or back pain. So for this is an occupational injuries that happened to nurses. So 40% of them who are working with geriatric patients, due to lifting and moving of those clients, they are having back pain and back injury. Farm injury also, permanent disabling condition, back injury is there during, for those who are working in farms. Vision and hearing problem due to noise and chemical exposure also is there. Currently also biotourism is a serious occupational health with a biological hazard. Illnesses are difficult to identify because of the long latency period. So in occupational health, sometimes the hazard, it is not a direct hazard that might happen to the client. It might go with a long run. So maybe after 2 years, after 10 years, the client will start to suffer. So it is a cumulative effect on those workers. So we have to judge on that. We have to do some study in order to prevent the occurrence of such problems in those clients. Skin disorder are the second most common occupational hazard. But skin disorder, because it is obvious, so it is easy to recognize them and it is easily to treat them. But the internal disease, like respiratory disease, like if it is affecting the liver, if it affects the lung, if it is in the long run affect the hearing, it is difficult to identify it in a short term. There are age group of occupational hazard triggered by the National Organization of National Occupational Research Agency. The first one, which is allergic and irritant dermatitis. Then asthma and the chronic obstructive pulmonary disease. The third one, which is fertility and pregnancy abnormality. The fourth one, which is hearing loss. The fifth, which is infectious disease. The sixth one, which is low back disorder, low back pain. The seventh one, musculoskeletal disorder for the upper extremities. The eighth one, which is traumatic injury. So those are the major hazard in occupational therapy. Allergic and irritant dermatitis. One, allergic and irritant dermatitis, it is the most common occupational skin disease. We said that it is obvious and easily detected. Because of that, it might be the first one, but the other, it might be hidden, and it might be even the effect of the work. It might affect the person even after return. So resulting from toxic reaction with chemical, those who are working in manufacturing and dealing with chemicals, dealing with paint, dealing with solvent, and also cutting those fluids. 20 to 24% of all contact dermatitis are due to allergy related to latex and pesticide which is used in agriculture. Delayed hypersensitivity, it might be there. So the sensitivity, it might not appear directly from the beginning. So it might take a long period of time until it appears. 10% of healthcare worker has irritant dermatitis due to latex, due to the gloves that we are using. So it might lead to latex dermatitis. Contact urticaria hedges occur after the irritant of allergic contact. So it might be an sudden effect of allergy. Prevention is preventable because the progress of the occupational irritant and allergic dermatitis is poor. Patients with occupational dermatitis often develop chronic skin disease, so they might develop chronic skin disease also. Intervention need to be developed to reduce the irritation of the allergy of contact dermatitis because their threat of rapidly emerging skin disease like latex allergy and also introduction of potentially harm chemical are in the workplace every year. About asthma and chronic obstructive pulmonary disease or COPD, chronic like chronic bronchitis, emphysema, bronchial asthma are the respiratory conditions that commonly affect the occupational worker who are working with certain kind of dust. The causes of this is the worker are exposed to sensitizing irritant such as ammonia, those who are working with chemical, and in manufacturing of dyes, chemical, plastic, and explosive material. Occupational also asthma is now the most common occupational respiratory disease, and mortality from asthma and chronic obstructive pulmonary disease is increasing. The condition of people who are already having asthma will be worsened by the work environment, especially exposing to allergic and chemical irritant. This is if the client is already having asthma before the work and he is working in a place that it has some chemical substances that it has vibration and he inhale that vibration. In this case, the condition it will be aggravated in that client. Asthma becoming a major new problem on United States of America and everywhere in those countries or wherever there is a chemical exposure or gases exposure. For healthcare worker to follow universal precaution, the use of protective gloves is increased. Hence, latex allergy also have become a major problem for healthcare worker due to use of the gloves. This condition is preventable, hence early diagnosis is needed for the effective intervention, and now there are other gloves that is non-irritant glove that they can use it. The exposure to coal dust, grain dust also, cotton dust are the common occupational agent also. Chronic obstructive pulmonary disease likely to occur in a dusty condition. So wherever a dusty condition is there or a dusty area is there, this chronic illness, it might occur. And it may be inevitable case to preventable disease and death. The worker with lung disease from other cases are vulnerable to occupational respiratory disorder and disease. So any worker also who is having lung disease is more vulnerable to allergy and to chronic obstructive pulmonary disease in case if he is working with them. Cigarette smoking also, it will aggravate the problem, is the primary cause of pulmonary disease in USA. Along with this occupational environmental exposure also, it will increase the risk of the obstructive pulmonary disease. Fertility and pregnancy abnormalities and disorder of the reproduction include birth deficit or birth defect, developmental disorder, so the development of the children because exposure to certain chemicals, exposure to heavy metals, exposure to X-ray or any kind of rays, it might lead to those problems. Spontaneous abortion also might be there. Low birth weight due to exposure to smoke, due to exposure to chemical fibers. Preterm birth also is there. Other disorder affecting the offspring like reduction of fertility, impotence, and menstrual disorder, it might happen due to changes to, it might lead to hormonal changes also. The occupational exposure to lead some pesticide also that used in agriculture, solvent can impair the fertility. The overall condition of the occupational exposure to male and female infertility is unknown. So it is unknown that there is no specific statistic which about that and the rate is not known up till now. Birth defect, because it is a long term. Birth deficit, defect are the leading cause of infant mortality in the United States. Neural tube defect, spina bifida, and neuroanencephaly. The child will born with lost part of the brain. Developmental disability are common also, like mental retardation related to impairment, hearing impairment, and vision impairment. The cause of them also is unknown. About hearing loss, it is common accepted problem. Most of workers are exposed to hazard of noise and risk from the auto-traumatic agent. Those who are working in airports, if they are not using the earplugs, also they are exposed to the high noise. Those who are working in construction also, they have to use the earplugs and in order to prevent hearing loss. It affects all age group also. Once the loss occurs also, it is irreversible. So it cannot be treated. The second most common self-reported problem in USA, so hearing loss is the second common self-reported problems. Effort to prevent occupational hearing loss is hindered because the problem is insidious and occur without pain. So it happened a gradual hearing loss to the worker without any pain. Problem related to occupational hearing loss related to quality of life because of social isolation. So after that, hearing loss has happened, it will lead to social isolation, tinnitus also, ringing of the ear, impaired communication with family member and public and other worker, because they will not be able to hear what they said, and they will not be able to understand them because they did not hear what they said. Diminished ability to monitor the work environment also, warning signal they cannot hear it, equipment sound also, lost productivity, so the productivity will be decreased, increased accident rate will be there because they do not hear the hazard, they cannot this sense is now away, so they cannot use that sense for as a warning for if anything happened in the working area. Impaired communication and isolation. Expense of the worker competition and hearing aids is there. Infectious disease. Infectious acquired in the work setting are diverse with many different modes of transmission. Infectious disease transmitted by human from patient to worker. So if for the health worker, it might be transmitted from the patient to the health worker and other health worker who are working at the hospital or the clinic. Worker to worker in variety of working setting. Bloodborne disease are also, and airborne pathogen are the most common in United States and also in other countries. Bloodborne pathogen including hepatitis B and hepatitis C, HIV are occurred primarily by the means of needle injury and also through exposure to eye or mucosal membrane. The risk also depends on the antigen status of the source individual, if he is under treatment or not, if he is known case or not, and under treatment. Hepatitis C virus transmission is increasing in the cause also is unknown for that. Evidence of previous infection of hepatitis C found in 1% of the hospital-based healthcare worker. So healthcare worker, 1% of them they are having hepatitis C. Transmission of tuberculosis within healthcare setting also, especially multi-drug resistant tuberculosis has emerged and a major problem. So those patients who are developing multi-drug resistant, they are having a strain of bacteria that not responding to antibiotic. So this type of bacteria also can be transmitted to the health worker and others if we are not taking our precaution properly, and it might increase the occupational risk. Reliable also data are lacking related to tuberculosis transmission among other group of workers at risk of exposure. Sometimes tuberculosis, they found also tuberculosis is more common in those who are working in hot and humidity places like miners. In some cases of influenza and other this condition are surely the result of exposure of infection person at the work, but there are not occupational disease because they also might have acquired them from the community. Low back disorder or low back pain. Low back pain is one of the oldest and the most common occupational problem. Roughly 80% of workers will experience low back pain sometime during their active working life. It is also one of the common cause of sickness and absenteeism from the work. Nurses are commonly affected with this problem because they are dealing with positioning and lifting of patient, transferring from bed to stretcher, transferring from stretcher to bed, positioning at the operation theater. So they are always at risk of developing the low back pain. Male constructed laborers also, carpenter and truck operating or operator were also nearly 2 times more likely to experience low back pain disorder than other male workers, because they are usually lifting heavy things. Diagnosis of low back pain is initially made by history and physical examination of the client. Occupational factors often associated with occurrence of low back pain include a heavy physical work, also, so those who are dealing with heavy objects, static work posture, also those who are standing for the whole day and sometimes bending their body while they are working, those who are working at operation theater and or some factories that need to be standing for the whole period of time, frequent bending and twisting while they are lifting something from here to there. So this also will lead to effort on the specific muscles and specific joint, so the pain will be there. Individual from low back pain recover from acute episode within a few days to a few weeks, requiring little treatment. So it depends upon the pain. Sometimes it will be developed and it will be chronic illness. Might lead to prolapse of the disc prolapse. So it might be the low back pain. It might be muscular and it might be disc prolapse. Modifying work activity or work restriction may be needed in the short term in order to give for that worker some rest and some minor work to do until he recover from that condition. Prevention of work-related low back pain involves several measures. Ergonomically sound working process, so the process of work it has to be smooth, and we have to use our body mechanics in a proper way, and we have to be trained well in doing and lifting, and we have to have some machine to help us in the lifting and moving. Optimal working level, also good working organization to reduce repetitive loading and fatigue. Training and education of the manager, healthcare and the healthcare provider about the disease etiology and control and the prevention strategies, which is the training on the how to use the body mechanics in the proper way, how to move things in the proper way, how to avoid risk of developing low back pain or overloading of muscle tension in a certain muscles, how to use more than one muscle one group of muscle at the same time when we are dealing with objects. Ergonomics, which is it means the work and the Nomus, it means law, the law of work. So it is the law related to the work. According to the National Safety Council, ergonomics is the science of designing the job and the workplace to fit the worker. So we have to design the working place in order to be as comfortable as possible for the worker in order to do his work in a best method and to increase his productivity. The goal of ergonomic is to allow the worker to allow the work to be done without undue stress. So it will reduce the level of the stress. Ergonomic hazard, additional information. So ergonomic hazard are those that involve the transfer of mechanical energy from work process which is cause a postural or other strain that can produce adverse health effect when certain tasks are performed repetitively. So when you are doing repetitive work at the same time, lifting heavy object for the whole day, and it is continuously, in this case, it might lead. Ergonomic also repetitive motion. When there is repetitive motion, poor working station, worker also outfit, lifting of heavy load, and when there is also vibration of the work at the work, which accompanied the use of power tools and vehicle. Example, many affect the internal, it will affect internal organs, like those who are driving and using heavy vehicles. The musculoskeletal disorder of the upper extremities. Here, the highest rate of this disorder occur in the industries which substitutional amount of repetitive force work of which happen at the neck and the upper extremities from the work factors affecting the employee is in every type of workplace. So because mostly when we are working, we are using our hands and moving our head while we are moving and lifting. So this will affect also the cervical vertebra, it will affect the cervical disc, it will affect also the hands and the muscle of the hand. So it might lead to tears of the ligaments, it might lead to tear sometime on the muscle fibers. Nerves might affect the nerves also, the carpal tunnel syndrome. So in this case, this site will become tight due to some fibrosis, and in this it will affect the muscle supply to the hand. It will affect the blood supply to the hand, and especially it will appear in cold weather. So the client will have difficulty or will have pain in his hand and difficulty to. Tendons also, tenous synovitis might be there, also peritendinitis and the epicondylitis, the inflammation of the epicondyle. In the muscle, it will lead to tension, neck syndrome, and the cost associated with this disorder are very high when it is held. So prevention of them is better. Traumatic injury, fatal occupational injury might happen. So the leading cause of occupational injury fatalities is increased in recent years, sorry, are motor vehicle, machines, homicides, falls, electrocution, and falling objects. So objects that fall over the workers. There were 4 industries in which occupational injury fatality rates that were higher compared with other working area, meaning death due to falling object. So the first one, death due to falling object, when there are dealing with loading object on vehicles, so those objects might fall on the person, and loading also on the store, keeping the object in a higher places. Construction, electrocution also, and fall, homicide is rated also, and public administration. Transportation, motor vehicle related death. In agriculture, machine related death. So the machine that we are using in agriculture, sometimes there are death due to that. Non-fatal occupational injury, job-related injury that resulted in lost working time or medical treatment. So there are fatal injury that may lead to the death of the worker. The other, which is non-fatal, that might lead to chronic illness or short-term illness, that it will lead to loss of working time, need medical treatment other than first aid, and loss of consciousness, restriction of the work, so the patient, the client will not be able to do the same work that he was doing. Motion or transfer to another job. Moving might need to move the worker who are affected to other job, and to train them also for the other job. The leading cause of non-fatal occupational injury involve time away from work, where sprain and tears. So when sprain and tears is there, so they have to leave the work for a long period of time. The place of eating and drinking establishment, hospital and grocery store, etc., are facing serious non-fatal occupational illness. Industries like shipbuilding, wooden building, and mobile home also manufacturing. And there is especially sawmills and meat packing plants also are leading to non-fatal injury. A major area of focus in community health nursing. Those are some of the major area of focusing of community health nurse. The present community-based practitioner research or practice research should be there. Transcultural nursing also. Nurse as a changing agent. Ethical and legal role of the nurse. Cost, containment, quality assistant also, evidence-based practice, health cities initiative also, or health sites initiative, credential and accreditation in innovation in community health nursing education, holistic approach. So all of them, they are focus of the primary health of the community health nurse and occupational health. The occupational health nursing role have expanded numerously to match the increase in the scope of the practice. So the scope of practice is increasing, and variety of occupations are there. Because of that, variety of accident and variety of health effect from those occupation is happened, and the nurse has to overcome them and to be knowledgeable about them. The American Association of Occupational Health Nursing describe the various role of the occupational health nurses to implement the role of efficiency. Occupational health nursing must work within an interdisciplinary framework with other health disciplines like industrial hygiene, safety specialty. So hygiene specialty, the safety specialty, and occupational medicine physician. So all of them, they have to work together in order to prevent the occupational hazards. The community health nurse role, well, she has the role as a clinician. So she works in the clinic in the occupational area. She is also the case manager, because she is the one who has to judge on that case. She is also the coordinator between the worker, the working administration, between the health facilities to also give referral to the worker. Health promotion specialty also, because she has to promote the health of the workers. Manager, she has to manage the work, manage her work, plan her work. She has to be nurse practitioner with a high experience in the practice of nursing. Also, corporate directors, and she has to be a consultant, because she will be consulted from the worker, from the also the administration, from others. Then she should be an educator for them, give health education and preventive measure, and she should be a researcher. So all of those concepts and roles she has to be familiar with. Link between occupational health nursing and environmental health nursing. The practice of occupational and environmental health nursing has changes dramatically over a time, which increase the emphasis on autonomous decision making, interdependent practice, prevention of health and health promotion, and analytical and investigation skill management and policy and development. So the environmental nurse and the occupational nurse, they are working within an environment. They have to know the kind of that environment. They have to know the hazard from those environments, either the work or the living environment, and give preventive measure and prevention of risk from that environment. This evolution, is a result of the need to a better deal with issue of changing workforce hazard, necessity of cost, contaminated and increase effect to promote the health productivity of the worker. So when we are managing when we are maintaining the health of the worker, preventing accident, in this case the productivity of the worker, it will be more. Occupational and environmental health nursing practice is guided by standard of occupational and environmental health nursing practice published by American Association of Occupational Health Nursing. It is also has a code of ethics to maintain the ethical behavior in the providing of occupational service. The referral here, referral box, page 41 in the textbook and page 1045 in the textbook. To apply practical skill, occupational health nursing practice require more specific knowledge in the field of nursing, have some understanding of increasing business and management, legal, regulatory field, and behavior science. This is the assessment and diagnosis and implementation of the standard. So you have to refer it, books 41, page 4. Books 41, 4. It include the assessment of occupational health nursing strategies. So you have to refer to it. Those are the standards. Worker and working place assessment and surveillance. So working and working place assessment and surveillance focus on the intervention of potential worker health problems and demonstration of the worker health status. Assessment can include also knowledge of the worker job, and so we have to assess how is they are working properly trained in their job, because when you are properly trained on the machine and your job, in this case you can use the machine and use your body and without any hazard, and or the hazard that will be minimal. And there also demands work process and related hazards, working condition, and exposure. As we said, in each working area, even in a factory, each worker is having a different type of exposure to hazard. So it is better not to shift worker from working area to other area, because if we are shifting it to him to other area of working in the workplace, sometimes we have to teach him about that area, about that machine. We have to, and in order to avoid the risk of dealing with that machine. The occupational health nursing should also do the following: history taking, collection of general health information. So the worker in the occupational health, she has to have a file for each worker in the institution. In some institution, nurses are there in the institution, and there is a rate also between the number of worker and number of nurses who should be there in order to take care of those patients, according to also to the hazard which might be there. Collection of general health information, collecting previous job history for that worker, exposure to smoking also, and anti-plastic agent. Pre-placement examination should be there, and periodic examination. By that, we are detecting early. If there is any problem, we will detect it early. Pre-assessment also we will see if he is fit for that job or not, or he might be at risk of developing the problem more. Assessment of workplace environment, assessment of the work safety also, knowing the common illness and injury at the workplace. The occupational health nursing usually the first person to receive complaint and must take step further. The role are also occupational health and primary care, so primary care provider, case manager, as we said before, health promotion and protection, counselor, management of and administration, community organization, research and trend analysis, legal and ethical monitoring. Occupational health nursing need to additional component, the link between occupational health nursing and the environmental health nursing, which is supported by the professional organization, American Association for Occupational Health Nursing, emphasize the need for additional component in the environmental health, which is include understanding the interaction of environment agent such as lead and waste product within the human system and related signs and symptoms of the disease which is related to that. Developing preventive protection and control strategies for all environmental health problems like indoor pollution and nursing environmental resources, including information for the agency from toxic substances and disease registry, discussing ethical and implication of environmental health exposure, such as right to know about the community toxic split, influencing regularly controls such as residential exposure in the environmental health and as appropriate. The objective in Oman program of occupational health to promote and maintain the highest possible degree of physical, mental, and social being of the worker in all occupation, to promote safety and health at the working place, to increase the awareness among the employee and the community and the occupational safety and the health aspect, to prevent occupational related health problems arising from working environment among the worker, to reduce the morbidity and mortality due to the occupational health injury. So those are the objectives of Oman occupational health programs. The strategies to implement, or in order to implement those objectives, the integration of occupational health in the healthcare services, training staff on occupational health in order to be there and to do occupational health nursing, enhancing the surveillance of occupational disease, occupational health promotion at the workplace, and also enhancing the intersectoral cooperation among the agencies. That cooperation, it will help in the provision of that care. The program of injury prevention and safety promotion will have the following concept. First, review the existing surveillance system within the health-related sectors. Develop feasible and sustainable, should be sustainable and feasible, surveillance program including coordination between sectors. Conduct a training program on data collecting, management, and analysis. Develop a framework for mechanism toward monitoring of the cases and the hazards. Strengthen the narration and data application practice and dissemination, strengthening dissemination and data application practice, implement intervention that are based on data and evidence, evaluate the impact of the intervention when intervention is taking place. Important notice, the occupational health nursing is a vast area. Some slide has details, information that's are some and some of that. Hence, as per the objective, you must go through your textbook also for the detail. Don't stick on the slide that we gave you. So the slide is giving you some examples of that. So you have to refer back also to your textbook. Thank you.